Senator Hughes.
Thank you, Chair. Look, I just wanted to start off, and you may as well get comfortable, Professor Skerritt. I think it's probably going to be questions for you. I wanted to have some conversations around vaping and e-cigarettes. So
I might ask my colleague Jenny Francis to
sure.
come to the table. Thank you.
Thank you. Morning. So I guess I just wanted to start whether or not thoughts around whether a nicotine-containing e-cigarette is actually a medicine.
It is in law in Australia. Nicotine-containing combustible cigarettes are not a medicine under the law, and therefore we do not regulate them. But nicotine is either... technically, chemicals and medicines are joined up in something known as poisons in the poison standard. So every medicine you take is also considered a poison in the poison standard, or if it's an insecticide, it's considered a poison. So in that case, nicotine in nicotine e-cigarettes is a poison and therefore either a chemical or a medicine.
But not in
combustible tobacco.
Not in a combustible cigarette, okay. And so cigarettes are considered a consumer product, but you don't regulate combustible
We have
tobacco.
no regulatory scope over them, no.
Okay. So why is the TGA trying to regulate e-cigarettes but not combustible cigarettes?
Well, as I said, we have no legal power to regulate combustible cigarettes, and unless if this place decided we were to, it's out of our scope. So as a regulator, you only look at what's within scope. Now,
So just to clarify, you're leaning more towards regulating combustible tobacco rather than moving e-cigarettes out of a medicine category?
No, I didn't say that.
Sorry.
I didn't say that, Senator. I said that we have no regulatory coverage over combustible cigarettes, the same way we don't regulate primary schools. So getting back to nicotine-containing e-cigarettes, they have for some years, for the purposes of smoking cessation, been a prescription-only medicine. And early this year, the TGA quite regularly looks at inconsistencies and clarifications, and so early this year the delegate saw there as an inconsistency if these products were brought in to Australia and used without an express claim for smoking cessation. There was also an inconsistency between Commonwealth laws where this appeared to be a loophole and state and territory laws where the sale of e-cigarettes containing nicotine or e-cigarette or the juice, the liquid, is actually prohibited by state and territory law in every jurisdiction, and the use, or possession I should say, is prohibited in every state and territory except for South Australia.
Okay, so how does the prescription regulatory model ensure product integrity and safety? So if the TGA's proposal is to regulate nicotine levels in e-liquids because it's a poison and it's a medicine, how does the prescription via importation model regulate the ingredients, any banned adulterants, the labelling, the packaging, the safety caps? So how does a prescribed importation model ensure that it's being produced under safety models, quality standards, that the safety caps are in place, what we would consider in Australia as a quality, that it's not being brewed in a bathtub in Southeast Asia? How do we know that?
Well, first of all, the consultation on just what the final regulatory changes are, if any, is still underway. The consultation closes on the 6th of November. And one of the things that's been raised in many of the discussions, because we had 3 webinars attended by I think over 200 people, and they were a very broad church between people who were regular vapers through to healthcare professionals, through to companies involved, through to pharmacist groups such as Pharmacy Guild. And one of the things many of the people raised is, well, should the decision have a line of sight to specific quality standards in the actual TGA regulatory decision? And it may, if a decision is made, and that will not be until mid or late December, depending on how quickly the delegate reviews all the submissions, it may well have those standards formalised. The other approach is that because it's a prescription medicine having to come in through a pharmacy, whether it's a central pharmacy where the thing's distributed online from an Australian capital city, or a physical pharmacy.
So can I just bring you back a bit? This is one of the recommendations at the moment. This is not where it stands at the moment, though. At the moment, you can bring it in personal importation. One of the recommendations at the moment is via a pharmacy model. That's not
can I explain?
That's not decided though yet, though, is it?
No, can I explain the three possible pathways?
Yeah. Okay.
So one is personal importation, and then it will be with a doctor's prescription, but there will be an element of buyer beware. And you could argue that's exactly the situation people have now. And the good news there is that many countries like New Zealand and European countries such as the UK have the range of quality standards to which you alluded. The second pathway and third pathways are through a pharmacy, either a physical pharmacy or a pharmacy that ships to you. And pharmacy procurers tend to require a range of quality standards, and we've been meeting with them about the possible quality standards they could enforce, such as the New Zealand or UK or European ones. So this is all still up in the air, but you're correct in saying that if personal importation is allowed with prescription, there is an element of buyer beware, and that's why it may be that many prescribers will say, hey, get it from an Australian pharmacy. That's the same message we give for medicines writ large. You know what you get if you get the medicine from the Australian pharmacy.
Okay, so if you're getting it from an Australian pharmacy, why can't you get it from an Australian company?
Well,
because, I mean, if I can get it from a New Zealand company, then why am I paying tax to Jacinda Ardern? Why am I giving the excise, the jobs, the manufacturing to Jacinda versus giving it to the Australian economy?
There is nothing. There's nothing stopping Australian companies setting up manufacturing and so forth.
But they can't sell it here.
But they can through a pharmacy model, the same way we talked earlier about Australian production of pharmaceuticals.
Why not be a consumer product like a combustible cigarette? Why put it through a consumer model? Why put it through a pharmacy model? Because then you can't have a GST through a consumer model, through a pharmacy model, script model. You can't have an excise through a script model. So you're actually reducing...
I think you've just argued reasons for keeping the price of this smoking cessation alternative down by not applying GST. But the main reason...
But then
Sorry, Senator.
Okay.
The main reason for the delegate proposing that it be through a pharmacy model, as it is already, but fixing this loophole, is, as part of smoking cessation, the best person to work with you, who knows your general health, who knows the diseases and conditions that you have, knows if you're overweight, knows if you've got other things like high blood pressure, is your doctor, especially your GP.
Okay.
And so the model is a GP working with you on smoking cessation, but being able to prescribe this as an avenue to smoking cessation if the GP and the individual want to give it a go and feel that it's an appropriate approach.
Okay. So talking about that, with the GPs and the doctors, how many doctors currently prescribe nicotine in Australia?
Oh, the number's minuscule because, as I say, it's about 10, I think, at the moment. But
so 10 doctors across Australia?
Oh, it's minuscule because at the moment there's this massive loophole whereby I could go online today and have it delivered to my home here in Canberra and not go to a GP. But that's not in the context of having the discussion about smoking cessation. And with a very simple authorised prescriber scheme where all a GP has to do to become a prescriber is to submit their APRA number and their address.
But don't we have that model at the moment?
The model came in July, but
and how many doctors have signed up?
But hold on, we haven't actually launched it because we're waiting to see what the decision is of a delegate.
Okay.
So there's no need for this until.
But at the moment, even
made.
Under the personal implementation scheme, at the moment, it is a requirement to have a prescription.
If it is
a legal requirement to have a prescription.
If it's personally
at the moment.
imported for smoking cessation, it's a requirement to have a prescription. We don't keep records of the numbers of those prescriptions. We have no idea how many.
Okay. So at the moment, if you want to quit smoking, there's about 10 doctors that you can legally go to quit smoking.
No, I mean, at the moment you could go to any doctor in the country and
what's
get
the AMA's
a script for
position
personal
on this?
importation.
Because my understanding is the AMA has publicly said they're not comfortable prescribing nicotine.
No, we've worked with that was an earlier statement, but we've worked with the AMA,
and have they come out and
including Omar
contradicted
Khurshid, the president
yet?
of the AMA, and discussed the new model and agreed that if it comes in, and we don't want to jump the gun, there's still a decision to be made in some months' time, and then it would only start from April or June. So there's a lot of ifs here. But if a decision is made, and say it starts in April or June, there would be working with the members of the AMA and the RACGP and other thoracic and other societies very closely on the process, on the evidence and what would be required. But it would be premature to do that now before any decision's been made.
Okay. Now, so say we overcome the AMA model and we get more than 10 doctors willing to prescribe nicotine. Well, actually, no, let's stick with the doctors for a minute. Are the doctors going to be prepared to work with patients around different type of vapes, different type of vaping kind of machines, the different types of products that are available? And then moving on from that, I suppose, going through that process, and if you go then to the Pharmacy Guild has come out publicly saying that they want really nothing to do with selling nicotine, and if they do, they want it to be at Schedule 3, not Schedule 4. Well, they've now decided what schedule they want it at, which is not the schedule that was originally proposed. Are pharmacists going to be prepared to work with people that are going through smoking cessation in managing their vape, in helping them with product management as occurs now through people that own vaping stores? Are they going to be prepared to help people learn how to fill their vape with, mixed vaping juices? Are they going to be selling pre-mixed nicotine into vape juices, or will they be selling nicotine in different flavoured juices? I mean, how is this going to work? Are pharmacists going to have to develop an entire new skill set for over 500,000 people who might take up this product?
There will be, as I said, in a period between, if a decision is made, in a period between now and April or June next year, there is an extensive education communications program with both doctors and pharmacists. There are materials, for example, from New Zealand on the sorts of products that help 1 pack a day versus 3 pack a day smokers give up. There's information on the different products that will be available, and there's actually a dedicated budget put aside, if this goes ahead, for working together with the pharmacists and the doctors. We've already had a number of preliminary meetings with both the Pharmacy Guild, the Pharmaceutical Society of Australia, the Royal College of General Physicians, the Australian Medical Association, about 6 or 7 other groups. But their preliminary meetings, although we've had 2 or 3 times some of them, because no final decision's been made. But there is a dedicated, or there's actually 2 lots of dedicated budget put aside for significant education and communication activities with doctors and pharmacists on all the things you listed.
What about all the vaping stores that are currently in existence, the small businesses that model those things?
No impact on them at all if they're obeying the law. So absolutely no impact if they're obeying the law. Let me say why that's so. At the moment, a vaping store in Australia can sell the vaping devices and they can sell non-nicotine containing vaping liquids. If they sell nicotine containing liquids, they're breaking the law in every state and territory. There is no impact on their business as far as selling the vaping devices or the non-nicotine containing vaping liquids. There is no plan, at least from the Commonwealth, to change the regulation of that. So,
have you ever been into one of the stores?
I have.
Yeah. Have you seen the regulations they have to go through in the bid to even try and sell you a vapour?
Well, there's similar things with tobacco.
No. It's extraordinary. They're actually not even allowed to offer you a vape when you walk into the store. It's really quite an extraordinary series of regulations.
So the message is there's no impact of this on their business unless if they have been willfully breaking the law.
Yeah. So, I mean, can we agree, though, that perhaps e-cigarettes and vaping products are harm reduction products?
They're certainly, I think the evidence is in that vaping is less harmful than tobacco smoking, but I don't think the harm is trivial, and I don't think it's 95% or any figure like that less harmful. In fact, there's a significant body of medical evidence on harms due to vaping containing nicotine. I mean, nicotine is a dangerous poison. It's also highly addictive. But it is, especially say if there's someone who has a mental illness, and that's a group that is disproportionately high in their smoking rates, certainly many people who work with people with mental illness are transitioning them from combustible tobacco smoking to vaping. But the end point for most doctors is nicotine freedom, is not smoking and not vaping. But
it is less harmful than combustible cigarettes.
That's the balance of evidence, but I think there's only one group that's really regularly pushed this 95% figure, and certainly there are a number of studies in humans indicating that nicotine vaping can be quite harmful, especially in adolescents.
But seatbelts, condoms, light beer, they all reduce risks as well, and they're all considered consumer products. Do you think that
No, condoms are therapeutic goods.
therapeutic goods? Sorry, well, let's take them out of
Yes,
it then, okay?
we're
driving and
we are the condom
drinking.
regulator.
Driving and drinking. Then we'll stick with seatbelt. We'll stick with seatbelts and light beer then.
How about medically supervised injecting rooms?
Yeah, well,
Medically supervised injecting rooms is the analogy you're looking for, Senator Hughes.
you know, I mean, are we going to start to treat any of these, you know, possibly as a consumer product and move it out of TGA, move it out of it being, you know, a therapeutic good, move it out of being a medicine? Because I mean, you could obviously not in Parliament House in Canberra, but any other Parliament House in the world, you could walk out the door and walk past a convenience store, a supermarket, a petrol station, and go in and get a packet of cigarettes, no problem at all. But something that is considerably safer, something that is a reduced harm product, you're going to have to get a prescription from one of 10 doctors across Australia. Good luck
Not from one
finding
of 10, Senator.
Get a script, find a pharmacy that's prepared to sell it.
Senator...
That's the current situation.
So any decision...
To not break the law at the moment.
Yes, any decision to change nicotine to a consumer good would require a change to legislation by this place, and it would also require similar thinking and potentially similar legislative or regulatory changes by every state and territory of the Commonwealth. So I can't say it'll never happen. On the other hand, I believe that, especially when I talk to public health and regulatory colleagues in places like Canada and the US, they are somewhat envious about our approach, given the significant increases in youth vaping. And the main concern is the increase to youth in vaping in Australia and similar countries, such as the US and Canada.
So I think it is really important, Senator, our focus is to use vaping as a smoking cessation aid. There is a big industry push to make it as a consumer product for non-smokers, to get them addicted. And the harm that is being done in Canada, New Zealand, the UK is very concerning. They are very worried about the huge uptake of vaping in non-smoking young people. We agree that it is a successful, in some cases, smoking cessation product. This approach is to limit it to smoking cessation, not to have it widely available as a consumer product. Now, I agree with you, if combustible cigarettes appeared for the first time today, they would almost certainly not be a consumer product. We're living with the reality of combustible cigarettes, but we don't want to be in the position. The Canadians are terrified now about the huge uptake in vaping in their young people, and they are seeing, and we've seen in the US, some deaths associated with vaping. There is no question that many companies are keen not to promote vaping as a smoking cessation product, but as an alternative product to get young people addicted to as a consumer product. That's the goal, is to keep it as a smoking cessation.
But isn't there a regulatory issue here? I mean, at the moment, if you've got...
Sorry. And I know that Senator Hughes has got a really big interest in this. I just wanted to ask on a time management question.
I mean, at the moment we're talking about personal importation, and we know that, you know, kids are importing very, very cheap vapes from Instagram, and, you know, clearly Border Force have better things to do than picking up a USB-looking fluorescent pink vape. But like we have restrictions on alcohol, restrictions on cigarettes, that if you're 12 years of age and go into a BWS, you're going to have to show ID. You have restrictions around caps, you have restrictions around quality control. Aren't you better having a regulated market rather than a broad importation market than you are? I mean, this is at the moment, we're having an importation market.
Please wrap it up, Senator Hughes.
That rather than a regulatory market. Aren't we better having a regulatory framework that is about cessation rather than importation?
This is precisely the intent of the delegates' interim decision, and you've talked about caps a few times. One of the things that the delegates asked for views is whether there should be child-proof caps, and to date the majority views that we're receiving is yes, there should be. So I think we are moving towards a regulated market with those protections that you mentioned, Senator.
Okay, thanks. That's time.